The future of medicine is here. I mean, if you saw back in the day the movie The Jetsons, there were the people that were flying around. It was a cartoon. They were flying around in a flying car, right? And they lived in the future. They had robots that helped them live their life, and they had this assistant that would come and do most of the tasks that normal people in our conventional world we're used to doing. We're used to working, and we're used to like cleaning dishes and vacuuming the house and doing all these things that in this world, in the future, that they had robots or they had technology to take care of them all. But for a lot of the people in this world, we have to take a quick moment and realize we've already been living in the future for quite some time. But the healthcare system and the powers that be, the big wheel, if you may, has been very slow to turn. If you've ever heard the analogy that in the ocean, that the big ships like the aircraft carriers, they may be able to carry a lot of weight and a lot of power, but they're very slow to turn. Whereas a small fishing boat may not carry as much power and people, but it's very quick to turn, very nimble. And in the same way, when it comes to healthcare and patient care in the US, we are coming from a situation, and if we're going to be real and understand the state of the US healthcare system, we have the worst satisfaction of any of the countries in the world. We have the worst expected healthcare outcomes of any of the countries in the world. We were ranked 36 just a decade ago, but now we're down to 69th of all the countries in the world. So we're slipping far and far behind. We spend about 2.5 times more per person in this country than any of the other countries on healthcare. Now, if we were just looking at that number, it seems like it's a good thing because we spend more on healthcare than other countries. But putting into perspective those other factors and those other statistics, we're spending more money on a worse result. And everybody knows you don't need to be a mathematician or an expert or a scientist to know that that's not the right direction. And that's not a good use of funds. We are misappropriating, or we're misusing at least 70% of all of our healthcare dollars, and it would be better spent, more efficiently used, and we'd have better care, not just for the patients, but us. We're all people, and we don't want to become a patient. So whether we're a doctor, whether we're in the healthcare industry, whether we're in insurance, whether we're a patient, no matter what part of the equation that we're on, we really want to create a win-win situation for us all. And a lot of these healthcare companies, insurance companies, and the conventional ways of doing medicine, especially the allopathic way, where we use a lot of chemicals or we use a lot of surgery, that now there is a lot of solutions for, that we'll talk a little bit more about in this video. A lot of these things are going to go away. But as you can see, a lot of these technologies have been available for 5, 6, sometimes almost a decade or more, but they're still not readily available. They're still not talked about commonly. And that's why I want to share, through videos like this, that there are technologies out there that are possible. And then I want to share, the small print. And at the end of the day, just because there's technologies out there that can rapidly accelerate healing and improve the health of our life, it doesn't mean that we should go and live a life that we end up in harm or we end up in trouble in the first place. Because although some of these technologies you'll see, they just take a couple seconds or a couple of minutes to fix years, decades, or a lifetime of damage, and it can repair it very quickly, it's not without its downsides. So for example, there's this new tissue technology where they literally just take a chip and with just a second, and it's not a chip that gets embedded into your body. What they do is they just transmit a signal, and it's actually reprogramming your cells, your genes, and it's using some form of frequency and energy to actually excite or basically signal the cells to mutate and to morph. And so this is an amazing technology because whereas in the past you would have to do surgery or some kind of other invasive method, there are more technologies that are coming out that are literally just using a chip or some kind of sound or some kind of vibration. And there's even, pencil beam laser technologies now that don't have as much radiation as the previous, chemo or cancer treatments. So there's amazing advancements in technology today. Like for example, outside of that tissue regeneration, like for people that had skin disease, tissue diseases, or any of that, skin issues was some of the hardest things to affect. But now there's a solution for that. As far as like tumors inside the body, there's pencil beam technology, which before with cancers, you would send a lot of radiation and chemicals into the body, but now they can be very focused and very specific and almost delete the cancer cell by cell. And it drastically reduces the amount of radiation that, the patient is exposed to. And number two, it's very effective at getting rid of cancer. But the reason I mention this is it's a great solution, but it's not without its downsides. It doesn't mean that just because you get the cancer zapped, it doesn't fix the root cause or the reason why you got the cancer in the first place. And these are lifestyle changes or choices that we make. And it comes down to the 7 health fundamentals that, I talk about in other videos and why I put together this health guide and this health planning concept at all that I call health starts from mouth. And when it comes to the other technologies out there, there's a lot of other options as well, like even sound. Yeah, even without the use of radiation, there is histotripsy, which is using sound waves to delete cancerous tumors, whether they're in the liver, and they're doing research on whether it works on other areas of the body, but they've proven that if you have a tumor in the liver, that they can use sound to delete that tumor. And it's amazing because then you don't use any chemicals. But even then, we want to pay attention to, are we looking at and are we focusing on the 7 health fundamentals for our life? And are we applying these fundamentals in the right way? Because again, if we don't, if we're living in a world of toxins, poisons, and contaminants, and we're drinking bad water and eating bad food and living in an environment that's surrounded with pollution, then we're creating that cancer. Even if it's not our fault, even if we haven't caused the pollution, just by choosing to live in a city or in a town or in a country that allows the pollution, that's the thing. And so there's a lot of federal mandates coming down that are cleaning up a lot of the pollution, by the way, that's happening in the water. If you don't know about it, I don't mean to be the bearer of bad news or to burst your bubble, but it's not safe to drink out of a hose anymore. Drinking out of the tap or tap water is probably one of the worst or most dangerous things that we can do for our health, especially consistently and over time, because you don't know what you're going to get. Like that movie in Hank like that movie in Forrest Gump when he says, life is like a box of chocolates. You never know what you're going to get. Well, that's exactly what the tap water is like, except it's not chocolates that are opening up. Who knows? You may get some brown stuff, but it's definitely not going to be chocolate. And when it comes to the contaminants in the water, we're dealing with, it's not just heavy metals and lead. That used to be the most pressing contaminant in the water. But as we get better lab equipment and as we understand our health better, we're realizing that there was things that fallen in between the cracks. So for example, the 2 main culprits and the contaminants in our water system today that affect us all, we're finding it in not just our tap water, but even in the most common bottled water companies that we see today. They have an exceedingly high amount of nanoplastics, not just 10 times more, but 100 times more nanoplastics than we previously thought. And the reason why this is a huge issue is it's not just plastics that are coming from the bottle. They use a very special light and a laser lab equipment to be able to see nanoplastics down to a smaller size than they were ever able to before. And now that they're able to detect them, they're finding out that less than 10% of the plastics could even be from the bottle, because if they examine all of the known plastics that make up containers right now, less than 10% of the particles found in those water bottles were from plastic containers. So the amount of plastic leaching from plastic containers isn't as much as we thought before. The problem is bad filtration methods and poor water quality, just contaminated water quality in our environment and in our surrounding. And what happens is it's not just bad for us. It goes into our food, into our plants, and it goes into our walls. These nanoplastics are so small, they get embedded into our cell walls, and they create, disruption in our hormones, and they can create, with bad water, other cancers and other mutations, other problems in our body. And especially if we eat the stuff, even if our water is clean and we get that right, but if we eat conventionally grown produce, even if it's organic, but they use contaminated water with nanoplastics, which most of it is right now in most modern cities and most modern growing systems, then we're going to be getting nanoplastics even through our food, through the plants, through the animals, and through the foods that they eat. And so this is a very big issue. And nanoplastics is one thing, but then the whole other issue that we're finding out is forever chemicals. And they call it perfluoroalkyl chemicals, or PFAs for short. And these forever chemicals are a bigger issue than the other ones because they do not boil out. And some plastics may be inert, some do disrupt the body, especially if they start overloading the body and they get embedded into our cells. But forever chemicals are something where even in a very small amount, at parts per trillion, like one drop in a lake, this can affect us. And so the very important thing about forever chemicals is that they don't boil off. They persist in our body, in the environment, in lakes, in streams, in the dirt, in soil. And this persists for years. It doesn't just go away, and it doesn't break down and easily degrade. Now they're creating solutions to get rid of it in our environment, in our water, in our food, because this stuff is so bad. But even with the, do not boil, or the boil notices telling people to boil their water, it doesn't really work for forever chemicals. And that's why this is such an alarm. And for the first time ever, there has been a federal law that has been coming down, not just validating, it is now they're going to clean up this mess. So it was one thing to get the federal government to ever admit that this was an issue. Not that the government or the people knew that this was an issue. We all know that there's contaminants in the water. But all the water companies want to continue to sell us water, and people, they thought, wouldn't buy it if it had all this contamination in it. At the end of the day, if we want clean water, it's our responsibility to clean it at the point of use. So when we need the water can be clean when it leaves the factory or when it leaves the treatment facility, but it travels through pipes that are extremely dirty today. And so we want to make sure that we have a proper point of use system that's designed and tested to the end of life. That's the biggest problem with the water filtration systems out there today. And I know this isn't a water filtration video, but I just want to touch on a lot of the businesses with this federal law. They're going to get in trouble, or they've been getting in trouble, because of water waste and contaminated water that they're spilling off or running off from the factory. And so this is going to get cleaned up, but the law has provided about 10 to 15 years or more for people to clean that up. And last time I checked, a lot of people aren't going to do too well without water for 10 to 15 years. I'm not just saying this as a joke. Most people just are not aware of how serious this is for their health. And we could be going, to the hospital or a doctor, and they're not talking about this stuff either, for drugs, treatment, and, for diseases that could be as simple as just, looking at that root cause, whether it's the water we drink, or, every pun intended, the problem's right underneath our nose. And we don't want to forget that, dental is medical, and the medical needs of our mouth are the most important part of our health plan and what we do to stay healthy. So I'm just going to end with that. Let me know if you have any questions about, any of the concepts that I talked about here, or the ideas I've talked about. And if you have any questions or suggestions. And just remember that health starts from the mouth. The mouth is part of the body, and health is from head to toe, meaning you can't have a healthy body without a healthy mouth. Take care, and we'll see you on the next video.